how do we do root canal treatment? This video is really cool because you can see that area that looks like a butterfly at the bottom is where the pulp chamber is. And pulp chamber is basically a room within a tooth that holds all the nerves and blood vessels that keep the tooth alive. Now, due to any reason, if you have inflammation inside this chamber or infection, for example, because of a cavity or because of a gum disease, you then will have a lot of pain usually. The nerve is inflamed, it's angry, it's hurting you, it's throbbing, it doesn't let you sleep at night. So the dentist will recommend a root canal treatment. When it comes to this point, the only other option is to pull the tooth out because somebody has to get rid of that nerve inside the tooth so you don't feel the pain anymore. Now, either we only remove the nerve or we remove the tooth altogether. Why do we do that? To be able to subside the pain and keep the corpse of the tooth over there basically for longer so you can use your teeth and keep your tooth. Remember that root canal treatments have some percentage of failure. They're usually not forever, and it'll just elongate the tooth for you, the lifespan of the tooth for you, until at some point you might lose the tooth. If you don't want to have a root canal treatment, the best thing to do is to have an amazing oral hygiene. Floss every night, brush your teeth after flossing, see a dentist every 6 months, and get your regular x-rays. Make sure that the dentist can see beneath the surface. Do not worry, the x-rays are quite safe. Yes, they have a bit of radiation, but their radiation is so small that it's comparable and less than a flight you might get from Melbourne to Sydney. Now here the dentist is removing all the amalgams first, which is the silver filling on the surface of the tooth, and then they're going to slowly reach the pulp chamber while the nerve lifts. At this stage, you won't feel anything because your tooth is completely numb. If you look on the right side of the tooth, you see that brown kind of stain coming inside. That's the cavity. That might be the cavity that caused this whole problem. It might not be, but you can see it's on this side. So basically, it shows us that maybe the patient didn't floss regularly, and that's why they got a cavity on the side of the tooth. Now, the dentist is getting rid of all the debris and germs of bacteria, and then later on, they're going to remove that roof on the surface of the pulp chamber and get the nerve out. That procedure, removing the nerve and replacing it with a filling, is called a root canal treatment or a root filling. Slowly getting lower. And if the pulp is alive, usually at this stage, there you go, it ended up in the nerve. At this stage, we would see bleeding. So removing the pulp horns, which is those little antennas you can see there now, and getting rid of the roof of the pulp chamber so we can get more inside and remove more debris and the infected nerve.